Do you feel tired after eating? Constantly thirsty or dealing with skin changes no one can explain? Most people ignore these symptoms, but they could be signs your body is no longer responding to insulin. Today, we're uncovering the 12 surprising signs of insulin resistance you should never ignore. Welcome to Levitas. Are you experiencing any of these signs? Leave a comment and any questions. 1. Fatigue. One of the most common signs of insulin resistance is persistent fatigue, especially after eating. When your cells become resistant to insulin, glucose can't effectively enter them, which leaves you feeling drained instead of energized after meals. This lack of proper cellular energy leads to an ongoing sense of exhaustion, even with sufficient sleep. A 2016 study in the Journal of Clinical Endocrinology and Metabolism found that people with insulin resistance had higher rates of daytime fatigue, independent of sleep disorders. The problem is that your body is producing insulin, but your cells aren't listening. This results in elevated blood sugar and excess insulin, which disrupts normal energy metabolism. Over time, the adrenal glands are also overworked, trying to compensate, leading to cortisol dysregulation and even more chronic fatigue. If you feel like you need a nap after meals or struggle to stay awake throughout the day, don't dismiss it. It could be a red flag your insulin sensitivity is impaired.
Want to burn fat and build muscle faster? I created a free science-backed supplements guide to boost your energy, fire up your T levels, and ignite your metabolism. No fluff, just results. Download the free guide now and start your body transformation today. Link in the description. This is how metabolic men optimize their stack.
2. You eat too much. Another clear symptom of insulin resistance is overeating or feeling like you're always hungry, even shortly after a meal. When insulin is high, your brain doesn't receive the proper satiety signals. This condition, known as leptin resistance, often accompanies insulin resistance and makes it difficult to recognize when you're full. In a 2015 study published in the journal Obesity, researchers found that higher insulin levels correlated with greater appetite and increased calorie consumption, especially from carbohydrates. This creates a vicious cycle. More eating causes more insulin, which further fuels insulin resistance. Additionally, since the body isn't efficiently absorbing and utilizing glucose, the cells remain starved, which sends signals to the brain to consume more food. This is why many people with insulin resistance find themselves snacking frequently, especially on sweets and refined carbs. If you're always thinking about your next meal, even when you shouldn't be hungry, it's a strong indicator of a metabolic imbalance linked to insulin dysfunction. 3. You drink too much. Constantly reaching for water, tea, or sugary drinks might not just be a habit, it's a warning sign. Excessive thirst is a lesser-known but significant symptom of insulin resistance. When insulin isn't working properly, glucose builds up in the bloodstream, leading the kidneys to work overtime to flush it out. This causes you to lose more water and become dehydrated, triggering a strong thirst response. A 2018 study published in Diabetes Research and Clinical Practice showed that polyuria and polydipsia, which are frequent urination and excessive thirst, were strongly linked to elevated insulin levels in early stages of type 2 diabetes. Moreover, if your cravings push you toward sugary beverages, it only worsens insulin resistance by spiking blood sugar further. If you find yourself drinking constantly, even when you haven't been exercising or eating salty food, it may be more than dehydration. It could be a signal your glucose regulation is compromised. 4. Thirsty all the time. Chronic thirst, known medically as polydipsia, is a classic symptom of insulin resistance and often the result of high blood glucose levels. As your kidneys attempt to remove the excess sugar, they draw water from your body, leaving you dehydrated. This leads to frequent thirst, even when you're drinking regularly. Constant hydration without relief could mean your blood sugar is chronically elevated. 5. You pee a lot. Frequent urination, also known as polyuria, is another early sign of insulin resistance. When blood glucose levels rise, the kidneys try to flush it out through urine. This leads to increased trips to the bathroom, especially after having your food. A 2017 study in Diabetologia confirmed that elevated insulin and glucose levels were directly associated with excessive urinary output, even in pre-diabetic individuals. 6. Nocturia. Nocturia is waking up at night to urinate, and this is more than an inconvenience, it may be a symptom of insulin resistance. High nighttime blood sugar forces your kidneys to work overtime, causing disrupted sleep. Studies like the 2020 research in the International Urogynecology Journal have linked nocturia with insulin-resistant states, particularly in adults with elevated waist circumference and metabolic syndrome. 7. Dark spots. Dark patches of skin, often seen around the face, neck, underarms, groin, or elbows, could indicate a condition called acanthosis nigricans, a visual marker of insulin resistance. This skin condition occurs when insulin levels become chronically elevated, stimulating excess skin cell production and pigmentation. A 2014 review in the Journal of Dermatology noted that acanthosis nigricans is present in over 74% of adolescents with early metabolic syndrome.
Want to become a high-performance machine? Track your supplements, sleep, hydration, and fat-burning habits, all in one simple tool. This daily tracker keeps you consistent, focused, and results-driven. Download it free now and start operating like a metabolic pro. Real results come from what you track. Link in the description.
8. Skin tags. Skin tags, especially in clusters around the neck, armpits, or chest, may be more than just cosmetic, they're a metabolic warning sign. These benign growths are more common in people with hyperinsulinemia. High levels of insulin act as a growth signal to skin tissues. Research in the Archives of Dermatology in 2007 found a strong link between skin tags and insulin resistance, even in individuals without diabetes. 9. Blurred vision. Struggling with blurry vision or difficulty focusing can be a subtle sign of insulin resistance. High blood sugar levels cause fluid shifts in the eye's lens, temporarily altering its shape and ability to focus. A 2018 report in Diabetes Care stated that fluctuating glucose levels are one of the most common causes of transient vision changes in pre-diabetic and insulin-resistant patients. 10. Regular infections. Frequent infections, especially skin infections, urinary tract infections, or yeast overgrowth, can be linked to insulin resistance. Elevated glucose levels feed bacteria and yeast, creating an ideal environment for overgrowth. A 2017 study in the Journal of Diabetes and Its Complications showed that individuals with poor insulin sensitivity had significantly more infections than insulin-sensitive counterparts. 11. It's hard to heal. Slow wound healing is another red flag of insulin resistance. High insulin and glucose impair immune function, reduce circulation, and delay tissue repair. This is especially noticeable with cuts, scrapes, or foot ulcers. A 2019 study in wound repair and regeneration highlighted how impaired insulin signaling slows collagen production and immune cell recruitment at injury sites. 12. High blood pressure. Chronic high blood pressure often develops alongside insulin resistance, even before glucose levels reach diabetic thresholds. Insulin affects sodium retention, vascular tone, and sympathetic nervous system activity, all of which can elevate blood pressure. A 2021 meta-analysis in hypertension research confirmed a strong correlation between insulin resistance and hypertension, especially in overweight adults. Managing insulin through lifestyle changes often leads to better blood pressure control and reduces cardiovascular risk.
Low energy, belly fat, weak drive. Most men eat 5 foods that quietly destroy T levels. My free guide shows you what to avoid and what to eat instead to reclaim your health, strength, and metabolism. Backed by science. Built for men. Download it free now. Your body will love you. Link in the description.
In conclusion, insulin resistance hides in plain sight. Fatigue, excessive hunger, and constant thirst are often overlooked as normal. But these symptoms reflect deeper metabolic dysfunction that disrupts blood sugar control and impairs energy production. Subtle signs like skin tags, dark spots, and blurred vision aren't just cosmetic, they're direct signals of elevated insulin levels. Frequent urination, especially at night, Indicates your kidneys are struggling to filter excess glucose, pointing to growing hormonal imbalance. Recurrent infections and slow wound healing expose weakened immune defenses, a side effect of insulin overload. And as blood pressure rises without explanation, it's often a cardiovascular warning tied to insulin dysfunction. These 12 symptoms are not isolated, they form a full-body warning system your body is begging you to notice. Recognizing these signs early empowers you to take control of your metabolic health and prevent progression toward type 2 diabetes and chronic disease. Thank you for tuning in to Levitas. Please share today's video with friends and family, comment, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated, it helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So, stay healthy, stay happy, and keep going.